Welcome back to the brain injury discussion. This is Jay. We are on episode 9, and today we will be talking about carbon monoxide. As usual, like, subscribe, leave a comment down below, especially if you have a topic you want us to cover, or maybe you have a question about a topic. We would absolutely love to hear it. So let's talk about carbon monoxide, or CO. So, carbon monoxide poisoning. This is according to a 2017 article in the American Journal of Respiratory and Critical Care Medicine. Carbon monoxide poisoning, pathogenesis, management, future directions of therapy. They describe carbon monoxide as odorless and colorless, and it's a gas. Uh, the common sources include, anything that really burns, especially fossil fuels. So engine exhaust is one of those common sources of carbon monoxide. Home heating furnaces, of course, in the wintertime, this could be more heavily used than in the summer, especially if you're trying to keep your home warm. And they also note that there are certain fires and sources of fire that cause carbon monoxide to be exposed into the atmosphere. Carbon monoxide, and they note this, that it is carried by the bloodstream to tissues. And in the context of the brain injury, it does lead to anoxia, or that loss of oxygen to the brain, and also what comes as the resulting sequela. Again, sequela being the term for after effects or secondary effects. And they note that the common symptoms of carbon monoxide are, very common. So dizziness, headache, fatigue, nausea, vomiting, altered mental status, as well as like respiratory issues or loss of consciousness. And when the patients are found unconscious, right? So you call 911. Ideally, you want to pull them out of that situation, but you don't want to put yourself in that situation. So you call 911, get that emergency help on the way. If you find them unconscious, that might be a problem because then you don't have a history of what was happening. Hey, maybe they were turning on their car, or maybe they, turned up the heat in their house. Those could be real life examples. And carbon monoxide, just like oxygen, fits well in a bloodstream, and it does be carried to the brain through the bloodstream, as we've talked about with other illnesses, as we talked about with other disease processes. And there are long term effects. And according to the same article, you know, memory problems, cognitive problems, mental health problems, motor vestibular deficits, as well as other kinds of like secondary effects that come from deoxygenation of certain tissues in the brain. And of course, there would be physiological effects on other tissues as well. And so let's just keep that in the back of our mind that this is another anoxic brain injury. This is an acquired brain injury, or ABI. So let's just keep that in the front of our minds as we continue through the literature that we got here. So, looking at a case study, this was out of radiology case reports, 2020, delayed brain injury post carbon monoxide poisoning, a study of a patient who worked in an auto shop. So, again, we have the modus operandi, and then he was in the hospital for multiple weeks, 4 weeks at least, and his condition actually worsened over time because of the carbon monoxide poisoning. And yet there were subsequent issues with his mentation, cognition, and that can be expected with carbon monoxide. And again, that was just a one case study that was put out in that magazine. So again, we need to do more research. We can't rely on just one case study, one patient. In an article titled Cerebrovascular Ischemia After Carbon Monoxide Intoxication, the Singapore Medical Journal, they did a case study on an individual who was found unconscious at their home due to carbon monoxide poisoning, and he was taken to the hospital. Unfortunately, in that case, someone did perish due to the carbon monoxide, but they were able to find someone and save them. And apparently, they go through all the like severe like all the details, but there were a few things that really jumped out at me that I think really, if you're especially an EMT or you work in an emergency room, or you're clinical. Um, you start noticing things after a while. Of course, the treatment was like managing the airway, trying to pump as much oxygen in as possible. But they also showed that, when they brought him in, they didn't know what was going on until they smelled some sort of a smoky smell on him. Now, again, carbon monoxide, odorless, tasteless gas, but the cause of what was causing them to make that carbon monoxide, which would have been that home heater stove. And so they were probably smelling something along the lines of like a propane or, some sort of gas, natural gas. And, again, that is something to think about. And in the same article, they really started looking at the different areas of the brain and what was affected. Specifically in that article, they note that there was some temporal lobe swelling, or there was some, death of the tissue in that area as well. And that was due to a cerebral artery occlusion. And as we know with cardiovascular anoxia, whenever an article is occluded, that means that there's no blood flow, thus cells start to die. And to give you kind of a general overview of where the temporal lobe it is, it's right here. That's the temporal lobe. And in the temporal lobe, you got a lot of sensory, a lot of motor areas. It's near the motor and the sensory cortex. So you have a lot of areas in the temporal lobe that do correlate. And yes, it is very important to top tip function. But again, brains, very complex, neuroplasticity. But it really goes into the detail about what they really see as far as the neurological sequelae or the side effects, the after effects, and they found that okay, artery was occluded, caused some tissue death and ischemia into that one specific area. And this next article kind of ties into last week's discussion about hyperbarics. Um, Article titled "Medical Gas Research: Neurocognitive Sequelae After Carbon Monoxide Poisoning and Hyperbaric Oxygen Therapy." They find that okay, putting them in hyperbarics with like very pure oxygen does help with some of the neurological and physical sequelae or that side effects or the after effects of that carbon monoxide poisoning. But they cite no evidence, with lowering mortality. But again, hyperbaric oxygen and using that as a treatment still remains controversial even for anoxia. And again, it's still not necessarily the accepted medical use for that, but it was definitely experimented on. And they found out that, it could be helpful. There's just not enough evidence to point to it being extremely helpful at this point in time. But then again, they're going to do more studies. They're going to be making sure that they're actually making sure that, before they approve something, that it actually does work. And they were really pointing to, in that article, again, medical gas research, neurocognitive sequelae after carbon monoxide poisoning and hyperbaric oxygen therapy. They had to note that not just the hyperbaric oxygen therapy was utilized. They note that there were other therapies being utilized concurrently in the treatment of this individual who had carbon monoxide poisoning, to include steroids, um, other kind of medicine, including some Eastern medicine, which again, we talked in a former video about acupuncture, acupressure, meditation, and combining that with the Western medicine of medications, active therapies, hyperbarics, and again, this needs more study. But again, carbon monoxide, we know what happens with carbon monoxide. So let's do a quick review. Carbon monoxide can produce a brain injury, an acquired brain injury, which again falls under that category of not genetic, not congenital, not degenerative. It is something that otherwise would not have been there. So the odorless, colorless, tasteless gas that again can be carried by the bloodstream to the brain. Now your brain does get a lot of nutrients and they come through the carotid and other arteries, and again that's sending fresh blood to the brain with that oxygen and with those nutrients in that liquid. Um, Odorless, colorless, tasteless gas. It is found in common areas. So if you own a car or you rent or own a house that has a oil furnace, a propane furnace, carbon monoxide um, can definitely be a danger present. They do make carbon monoxide detectors, and that might be a good investment. It would be one of those things where, as we talked about with the story that was done by the Singapore Medical Journal about the cerebrovascular ischemia, um, if they had had a carbon monoxide detector, chances are that patient and their family would probably be in a lot better shape, assuming the detector worked as properly intended. Um, and this is something that, a detector of this, especially if you know that you're using oil and gas, um, probably is a good idea, especially in confined spaces, or if you're working in an auto shop, like another one of these articles noted. You know, think about what dangers are in your home and what other brain injury dangers could be in your home. And, thinking about those fall risks, thinking about those slip hazards, but also this one might be a little bit you know, underrepresented, you might say. But according to that American Journal of Respiratory and Critical Care Medicine, this happens to tens of thousands every year, in spite of the declining amount of deaths or the declining mortality associated with carbon monoxide poisoning. So, and again, that could be in part because of early detectors. That could be in part because of technology. Obviously, sometimes, you know, early technology or they make technologies to kind of monitor you. That might be something that might actually save your life there. But if you know that either your home or your garage is at risk for this, it might be worth it to get that carbon monoxide detector. And of course, just to be aware of your surroundings. Anyways, like, comment, subscribe. I hope everyone has a wonderful day. And if you have a topic or an idea or a comment, feel free to put it down below. We love comments. And, definitely keep in store for the next few installments. They're going to be really interesting. Have a good one, all.